Welcome back. Dr. Nashaba Matin is my guest today, and we have been talking about HIV in Bangladesh, and after a few minutes we'll come back to London and her work at Royal London and the Barts Health. Dr. Nashaba, we were talking about a stigma attached to this disease. We have a stigma attached to any disease at all. See, I mean, I was earlier this year I was in Hong Kong, see, and somebody was coughing, and another person just approached him and said that you can use this mask.
Yes.
See. And I looked down carefully, and I said, yes, everybody was using a mask.
Yes,
see.
that's right.
Except
Very
me.
common in Hong Kong, yeah.
Except me.
Yeah, but you will see that in Hong Kong and parts
Yes.
of Southeast Asia.
Yes.
Yeah.
See.
Yeah.
So there is a stigma attached to all kinds of ailments and diseases and infections, see. But are we more careful about health, that we attach a stigma to so many diseases? Is it because HIV is such a dreaded disease?
Yeah, I think, well, I mean, stigma, often equates to some sort of shame about something.
Yeah.
So there's less stigma, I would argue, to say that you have cancer than to say that one has depression, for example.
Right.
So, both of them are actually illnesses, both have therapies, but people are more willing to admit that they're suffering from cancer than they're suffering from depression. And they are also much more willing to admit that they're suffering from cancer than they're suffering from HIV infection.
True.
The level of stigma with HIV is very large. And I think it's the biggest barrier for many of our patients. They actually don't come to clinic to see us because they don't want to be seen to be coming to the clinic.
Right.
They don't want to come and take the medicine for HIV because every time they see the medicine, it reminds them that they have HIV.
Yeah.
The fact that the medicine will keep them well and save their life almost is not enough of a reason for them to come and see us and to take the medicine. And I'm very sad to say that a number of my patients have actually died because they were almost, the stigma was too much and they weren't really able to...
It's also within the family, isn't it?
It can be, yeah. So it can affect the mother and the father and the children. And so in itself, it can be very difficult for a family to cope, especially if there's a lot of illness associated with it.
Right. See, in some of the papers that I have read, and also when I was researching about you, that you mentioned discrimination. See,
Yes.
discrimination on the basis that somebody is suffering from a particular disease.
Yes, absolutely. So our patients here talk to me about how they sometimes feel discriminated against, whether it be in the workplace, which is why they do not want their workplace to know that they're suffering from HIV, or whether it's through other primary care providers. Some of my patients are very reluctant to engage with the GP. Some GPs are wonderful and very supportive, but there are some where the patients feel that they are less supportive of the HIV.
Well, sometimes their files are seen by so many other medical workers.
They can be, yes, yeah, that's true. Although obviously all of us are bound by our principles of confidentiality.
Right.
And it's very difficult to provide healthcare one-to-one. We work in teams. So ultimately other people do need to be aware of what's happening. So it is very difficult. But the discrimination is real, and the discrimination not just here, but maybe going back to Dhaka and to Bangladesh again, there was discrimination there.
How can we address this discrimination?
So it's all about knowledge. It's about increasing knowledge and understanding. So discrimination and stigma is often embedded within ignorance. So if you don't understand about something, then you fear it. And if you fear it, then you're much more likely to shun somebody and to discriminate against them.
Very correct, yes, I see. I don't know if you were there or not in Dhaka, but I remember there was a slogan, "Bashte hole jante hobe."
Yes, exactly.
This was...
Bashte hole jante hobe, yes.
So knowledge, as you said, is very important.
Knowledge, to survive, you need to know. Yeah.
Yes. Let's take a step back from Dhaka to London. Here you are working with a number of hospitals, and also you spent your time at Royal London. What sort of work are you involved in? Is it mainly HIV and?
Yes, yeah, that's right. Yeah, so I'm an HIV physician here at the Royal London. It's called Barts Health, and Barts Health encompasses a number of hospitals. So
Right.
we are the largest trust in the country.
Which hospitals?
The Royal London in Whitechapel, St Bartholomew's, Newham Hospital in Newham, and Whipps Cross Hospital, which is in Waltham Forest, and also Myland Hospital.
Do you have to visit these hospitals?
I do, yeah, yeah. Not every day, but we have HIV services that are provided from three of those hospitals, so I do visit those three, yeah.
What sort of facility you have for HIV patients in hospital?
So, I mean, obviously in the UK we have a very different level of infrastructure, and we have very good healthcare for HIV patients. So we may not have very fancy clinics with, you know, fancy TV screens, but we provide some of the best care in the world for HIV patients, and our outcomes are amongst the best in the world.
In all these three hospitals?
Well, obviously I'm biased, but we are one of the largest clinics in the UK, which means that we're one of the largest clinics in Europe. And so we look after HIV patients, over 4,000 of them are registered for care, and we have a very, very big unit, many doctors and nurses. We have an inpatient unit as well, looking after very sick patients. We have a very active research unit as well, where we're researching new drugs and lots of sociological research around HIV, as well as scientific research. So it's an excellent place to get care, for sure.
Great. Like in Bangladesh, you said that the incidence of HIV is in a particular group, particular area of population. What is your observation here in this country?
Yeah, it's a bit different here. So here, the two largest groups that were originally impacted by HIV would be men having sex with men, okay, and also African populations. Now we are seeing much more spillover into the heterosexual population of the UK, who are from here, as well as people coming from overseas. The very positive things that we see is that 20 years ago we used to also see HIV infections in children, and that is now becoming vanishingly rare, because we are much better at testing people, diagnosing people, treating them early, so that mothers do not pass it on to their children.
Right. You mentioned among the African population. Why?
So,
is there any particular genetic reason for that?
So, well, as I said earlier, that there are some theories that the HIV virus originated actually within the African subcontinent,
Right.
and it spread through from the African population.
Okay.
Yeah. So that's one of the reasons. Anytime you have a situation where you have lack of healthcare infrastructure, war, conflict, anything like that, disrupting healthcare, disrupting families, disrupting the sort of structure of society, that's the sort of places that HIV can then spread. And if you look back over history over the last 20 or 30 years, there are, in some parts of Africa, they've obviously gone through some incredibly difficult times with civil war, civil unrest. And so during any of those times, we've seen big rises in HIV incidence.
What can be, as a doctor, what can be done to, first to make people aware, and then to check this infection spreading?
So awareness obviously comes from education. I think programs like this are wonderful. So thank you for inviting me today, because you know the forum of media is very powerful, and you can reach you reach far many more people with media than I can reach by giving a lecture, for example, in a lecture hall.
Inshallah, you'll be reaching far more people.
Yes. So so I think to educate the population, and not just adults, but educate children as well. So I think if you can educate from a young age about how to live well, how to live safely, how to have safe sex, or how to negotiate safe relationships, not to inject drugs, you know, all of those things that we build upon, all of those will help. In terms of how to prevent the spread, we actually now have many tools to prevent the spread of HIV. And some of that is obviously just using condoms. Very good, adequate screening of blood, which we have now in this country. helping injecting drug users to either stop injecting drugs or to use clean needles rather than dirty needles. And then
If not, stop using drugs completely.
yeah, if you can't stop, then let's make it safe.
Right.
And the biggest thing really is the drugs, the HIV drugs that we have. So putting people
Are
on...
are those drugs too expensive?
Well, it depends on how you look at it. So it's a worthwhile investment, because if you put somebody on therapy, they remain well for life and they live a productive, happy life. The cost of HIV therapy has come down significantly over the last few years anyway. Some of our drugs have now become generic. So when they become generic, then it means that other drug companies can make the drug for a lot cheaper
Well,
price.
Dr. Nashaba, we are at the fag end of our program. Just in a few seconds, can you tell me what is the situation of NHS right now?
Oh my goodness, that's another whole program. The NHS is a wonderful institution, and I think we have to all treasure it and cherish it. I think that it is under a lot of challenges at the moment, politically.
Does it need blood transfusion?
I think it needs some life support, actually, yeah. I think it does needs strong political support, and it needs public support. Otherwise, I think that the NHS is in a dire situation. We see it every day in Barts Health because we are supplying healthcare to the whole of East London. So we are a vital part of East London, but we are struggling on a daily basis to try and provide everything that the patients need.
Well, that's the end of the day.
Oh, thank you very much.
Thank you very much for coming along.
Thank you.
It was a pleasure having you on the show.
Thank you for having me. Thank you.
Thank you, viewers, for being with us, and I hope that you've enjoyed the show as much as we have. And same time, same channel next week. We will see you again. In the meantime, take care.